It's a difficult question to answer, and it depends on the embryos, really. The first few days up to day 3 is mainly down to the egg and also the environment that egg is in. So what we would like to see is from that egg, from the fertilization stage, to develop and cleave into a nice even 2-cell, and then each one of those 2 cells to divide evenly into 4 cells, and then on day 3 go on to a nice 8-cell. And then what happens if that 8-cell embryo, which is good quality, when we check it on day 5, if it's still a really nice 8-cell quality embryo, it's then due to in most cases due to the sperm, because the sperm have to flick a switch within that embryo called the embryonic genome, and that allows the embryo to pass that first checkpoint to make a blastocyst. Now, the sperm can only do that if that embryo is in a good enough place to actually do it. If that egg has not developed well from the fertilization stage, and it's a 2-cell that fragmented, and then maybe done some direct cleavages, so sort of like and those 2 cells have split into more than 2 cells, and that embryo is not in a good place, the sperm doesn't have the best chance of actually flicking that switch, because that embryo isn't really compatible with going to a blastocyst. It does still sometimes happen, but it's just one of those things. If you see lots of good embryos on day 3, and the blastocyst formation rate is reduced, so say under 50%, then it could be a sperm issue, and we should maybe be looking at sperm DNA fragmentation. If actually the embryo development wasn't good to day 3 and we're not getting blastocyst formation, then that's more than likely an egg issue. So again, it will vary patient to patient.